Do you wonder if you have an autoimmune condition? Perhaps you have been diagnosed with one and wonder how functional medicine can help you. My name is Dr. Sharon Borkowski, and I'm a functional medicine provider at Naperville Integrated Wellness. I'm going to take a few minutes to talk to you about what autoimmunity is, what causes it, what are some of the common symptoms that are associated with these conditions, and finally, I will share what your available treatment options are. Now, what is autoimmunity? Well, simply stated, autoimmunity occurs when the body begins making antibodies that result in damage to body tissues. Now, before you say to yourself, what are antibodies? Let me tell you. Antibodies are proteins that identify and neutralize foreign objects such as viruses and bacteria. Essentially, these antibodies tag things for destruction and send signals to other immune cells to cause destruction of the proteins that are tagged. Now, in the case of autoimmunity, however, these antibodies are tagging body proteins, and those result in damage to our own tissues. Now, what causes autoimmunity? The exact cause is unknown. What we do know is that the environment and genetics play a role. Stress can be a trigger, and nutrient deficiencies can have an impact. Poor gut health and infections may trigger or worsen an autoimmune condition. Now, the hallmark of autoimmunity is inflammation. So when a person has chronic inflammation, it's important to evaluate and uncover the cause. This is what we do in functional medicine. When we see evidence of things such as inflammation, one of the things we look for is autoimmune as a cause. Now, let me share a few of the symptoms that are commonly seen with autoimmune conditions. Joint muscle aches and pains, bloating, diarrhea, abdominal pain, blood or mucus in the stool, food sensitivities, acid reflux, nausea, skin rashes, dry eyes and mouth, fatigue, weight gain or loss, brain fog, confusion, or difficulty thinking. Now, these are just a few of the examples, but please understand that just because you have one or more of these symptoms does not automatically mean you have an autoimmune condition. Now, that brings me to my next discussion point. How do you know if you have autoimmunity? Now, my suggestion would be to find a qualified health professional who will take the time to get a detailed history, a comprehensive blood panel, including appropriate antibody testing. Now, this would be the first step in evaluating and identifying the root cause of your symptoms. Now, what can be done about autoimmunity? First, it's important to understand that there's no cure for autoimmunity. Conventional medicine treatment for autoimmune conditions includes immune suppressant drugs. These medications weaken the immune system and can result in a decrease in your symptoms. However, these drugs also suppress the body's ability to fight off any bacteria or viruses that one may be exposed to. The functional medicine model of healthcare offers a patient-centered approach to identify and treat chronic disease. And the purpose is to obtain the root cause of the patient's illness, including triggers, poor nutrition, stress, for example, toxic exposures, in order to create the best treatment strategy. In addition to this information, a functional medicine provider will utilize blood testing and other functional testing in order to identify what might be contributing to a person's symptoms. Once the root cause is determined, a plan of action is created and implemented. A functional medicine plan is a collaborative plan that requires the patient to be an active participant. And with time and commitment, a patient with an autoimmune condition can make great strides in improving their own health and quality of life. If you would like to obtain more information about autoimmunity and how functional medicine can help you, reach out to us here at NapervilleIntegratedWellness.com.